after 50, not even exercise. Repairs fatty liver. Very difficult. Everybody over 45 with a little bit of a belly, they have fatty liver. Even if you don't have a big of a belly, you're gonna have fatty liver. Hormonal imbalance and detoxification. Okay, so let's move on. This is a graphic I did the other day. Basically, it's what I said, right? It gives a signal, and that signal starts expanding, right? The signal goes to your brain, and it starts expanding, all right? And this is what it gives you. Increases testosterone, reduces cortisol, major. You'll find why cortisol is very, very bad for us. Then reduces the hunger, healthy liver, increases your metabolism. BMR, that is the basal metabolic rate. It's how many calories you spend. When you're 20, you spend a lot more calories than when you're 50, okay? That's why people start putting on weight, is the BMR, that's the basal metabolic rate. It decreases your BMI. Fitness, energy, you burn more calories because you increase the BMR, right? You increase the libido. People are happier. They feel lighter. They feel happier. You increase muscle. You feel younger. You increase growth hormones. Very important. We need growth hormones, especially if you're all young. So you probably don't understand the significance of that. But wait, you're gonna get there. So you need to be ready and prepared and proactively. Increases leptin, that is the hormone that stops you from eating, okay? It actually, optimal, that's the good cholesterol, okay? We'll talk about it later. You can control diabetes with it. We have controlled diabetes with this machine. Now, it decreases BMI, reduces inflammation. What is aging? Aging is inflammation. Anti-aging is lack of inflammation. So if you want to do anti-aging, you need to focus on getting rid of inflammation, okay? Reduces visceral fat, repairs fatty liver, reduces toxicity, major. If you're toxic, you're hungry. The more toxic you are, the more hungry you are, okay? Decreases bad cholesterol, that's major again, you know. Loses fat, of course, by sculpting, controls appetite, and regulates glucose and insulin, which is why it can help with the diabetes, okay? And that's another graphic that I did, how to increase body intelligence, basically, or the intelligence, because that's what we do. Everything in the body is connected, okay? So hormonal balance results in a sort of domino effect. If you're hormonally balanced, then you're gonna be like this, right? This is a balanced hormones. Yes, a healthy body, you know, fit, energetic, full of, ready to go, okay? Not just in life, not just in the gym, all right? And if you're not balanced, boom, this is imbalanced hormones, okay? Inflammation, toxicity, fatigue, hunger. So one of these systems breaks, the whole system starts lagging, okay? That is extremely important. So what do we want to do? We want to establish hormonal balance. What we want to do, we want the body to function like a younger body. And this is what we can do. This is not a slimming machine. This is an anti-aging machine that increases the intelligence of your body. Okay, so here we have exercise, of course, will balance hormones. That is a fact, well-known fact. And sedentary lifestyle, if you sit around and do nothing, will imbalance you. Now, this is the question. Have you ever seen an obese 90-year-old? Has anybody seen an obese 90-year-old or 80-year-old? Have you? Scary, right? That means they die. They don't live long, right? That is a fact. It's right there. And the virtual gym drastically changes your body and reshapes your lifestyle. This is a testimonial from one footballer. He said, I got 40% more fit after one treatment. He obviously did more treatments. He bought his own machine, but that's that was the thing. It's like, my God, this works. Now, there are limitations with exercise, okay? As you can see, if you do a lot of aerobics, what you see, you have some reduction of visceral fat and some liver improvement, but it's modest, okay? And if you do resistance training, you're going to reduce your cholesterol, and you're going to increase muscle mass. This is, like 8 weeks. Of course, if you do much longer, it's going to work much better, obviously. But we're talking in a shorter period of time. BMI did not change in most of these studies. Now, if you're over 50 years old, guys, you're not going to end up like this. You're going to end up like that. Why? Because the visceral fat will not you're not going to be able to get rid of the visceral fat. Why? Because you need such strenuous exercise to get rid of your visceral fat. You're going to injure yourself, okay? Or you're going to have to be in the gym all day and do nothing else other than kind of do the gym. Okay, there's another problem with strenuous exercise, lactic acid. You see the next day after you exercise that you feel pains, that's the lactic acid. It's an anaerobic mechanism that jumps in when you run out of oxygen, you run out of breath, then you got the lactic acid the next day, you have the pains in your legs and your muscles. However, it can lead to lactic acidosis, and that upsets the body's pH balance. So, body's pH balance is upset, what happens? Aging, okay? One thing goes down, everything starts going down, okay? Now, the other problem with strenuous exercise is that it increases cortisol and decreases testosterone. Because you are trying so hard, especially if you're older. Those things don't happen when you're 18 and 20 and 25. But as you're aging, it starts happening. So cortisol will go up. What does that mean? This is the optimal, so this is the guy that has good testosterone, have confidence, he's happy, sharper mind, increased muscle mass, healthy heart, strong erections and healthy libido, strong bones, plenty of energy, right? Here, this guy is depressed, he might be in risk for Alzheimer's disease, increased fat tissue, increased risk, low libido, increased risk of osteoporosis, and so on and so forth. This is high cortisol. Here, you've seen a lot of women walking around like this, right? Big stomach, some bruises, thin arms, like this. A lot of stretch marks. You've seen a lot of these ladies, right? That's high cortisol right there. And when you do, we have done several studies. Now we'll put them all together, all the studies together. So 130 patients, testosterone went up by 52.20% and cortisol came down by 92%. Now, listen, these percentages don't mean anything, okay? Why? Because you don't want to go above or below the normal range. So it depends where people are. If they're right here, and the range stops here, you want them at the peak, but you don't want them above that, because that's going to be a problem as well. That's imbalance. Anything above or lower the normal range.
I want to know the sample size 130 patients. What are the average age?
They were all old. It would start, the younger would be, I think, 38, and then the older would be 65.
Oh. So how about
or 67.
The average age, maybe nearly?
My average, I would say, again, you cannot do that because it doesn't mean anything, right? It's a statistical thing, but it doesn't mean anything in real practice. Maybe like average age would be like 49, 50. If you add all these numbers together and you divide them by 130.
Yeah, because for people going through menopause, the situation going worse much more. So
that's right.
So if this one can help the maybe lady who going through menopause and do the same.
Oh yeah, somebody like you would be flying if you do some treatments. You won't even need that many. You're gonna be flying. You won't even need to take the bus. You're just gonna fly from here to your house. because it makes you feel that you're on top of the world, very energetic. Yeah, it will work much, much better for young people. Everything does. Even things that damage work well for the young people. Everything works. Okay? But the whole point is, the way I was trained is that you always look at something, at a population that is more damaged or disturbed or whatever. And if you can learn that, then you can do everything else. You always go with what is the most difficult. And if you can prove it with the most difficult, then the easy part is nothing. Okay? Yeah, this is a very good point. Yeah. Okay, so this is, I made the movie, it's basically, it has for the motor nerve, okay? But the motor nerve is still not active. It goes inside the motor nerve. The motor nerve starts giving the signal, something is happening. The afferent nerves, the sensory nerves, carry these signals to the brain. And the brain releases hormones, estradiol, testosterone, insulin, and the insulin is like it unlocks the fat cell to release itself, and then it locks it again. It says, now I won, now I'm gonna stop it, okay? So, and then of course, that's gonna go into the mitochondria, it's gonna burn with oxygen, and it's gonna create the energy that you need to build muscle, to breathe, to repair the organs, all kinds of these things. Okay, so this is the virtual gym, the newer technology. It offers about 256 exercises, repeated 1,000 times in 1 hour. So it's like you're making like 25,600 exercises. You cannot do that in the gym. Come on, it's impossible. It's gonna take you 2 to 3 months. That's what we're saying, one treatment is like 3 months in the gym. Of course, if you're in the gym all day, every day, that's a different story, but not too many people do that or can do that. So you have strength exercises. It's how we develop the waveforms to make it like a strength that you hold it, and it's for 10 seconds, okay? You cannot do that with a muscle stimulator. A muscle stimulator goes like that. It cannot give you a 10 seconds contraction. The only thing that can do that is your brain. Only your brain can hold it like that. And your brain can go like this, or it can go like that. It's like different movements. It's like you're dancing, you go from a dance studio to the gym and back without moving, obviously.
Why 10 seconds? Why 10 seconds? Why 10 seconds?
Why 10 seconds? Well, the longer you can hold, the better it is. There is no, it's the longer you can hold it. You can make it 7 seconds, you can make it 8 seconds, but I prefer the longer you can, and it's more stable now too. So the longer you hold it, the better results you can give. And you see, the problem, you cannot hold them. Some people hold this and they hold the breath as well. Here, you don't have to do anything. The machine does that for you. It gives the signal. Your brain, you go like this. You don't know why. It basically, it moves your body as, it just does this for you. And you'll see that we have some aerobics things, and you'll see why you don't need cardio. You'll see later.
And the other question is why you put the patch all over the body? So you are doing the 10 seconds synchronizing your body at 10 second interval, right?
Yes.
Why your whole body? Why
Yes.
the whole body?
Yes, that's a brilliant addition. Yes, thank you. Yes, did you hear that, guys? That's a very, very, this is, he always takes things and he makes them much better. So basically, remember what we said, we need to synchronize the body, right? That's the balance. That's anti-aging. Anti-aging is how we can synchronize our bodies. That is your anti-aging right there. Inner health and how to synchronize your body. So what it does, you put the parts everywhere, it takes the entire body, involves the entire body. Now the whole body is synchronized, all your hormones are synchronized, the whole thing starts working as if you're younger. This is the different items, and I'm going to explain basically testosterone, cortisol, visceral fat, overall fat, BMI, BMR, that's the metabolic rate, muscle mass, insulin growth factor, free T3, glucose, and fasting and postprandial. This is the physical exercise. Remember we said testosterone goes down, cortisol goes up. With the virtual gym is the opposite. Testosterone goes up, cortisol goes down. That's what you want, okay? Because what? Because you don't put any effort in it. So the cortisol does not increase. Why would it increase? If anything, it decreases, because here is the deal. If this goes out, this is gonna go up. If this goes up, this has to go down. That's why your cortisol decreases. Do you understand? They have a relationship. It's like a seesaw. If I increase my cortisol, my testosterone will go down. If I increase my testosterone, the cortisol will go down.
I want to know, is that for the tremendous exercise? If for normal aerobic exercise, it should be exercise and decrease cortisol, right?
Normal aerobics is gonna do what? Say that again?
When you do exercise, it actually burn up your cortisol to make you more relaxed.
Yeah, well, but the effort that you're placing will increase your cortisol.
Oh.
Now, and again, of course, if you're younger, it's gonna work the way you wanna work. But if you are older, because when you're older, you have to exert more effort. Remember, the BMR of a 45-year-old is much different than the BMR of a 20-year-old. A 45-year-old needs more effort to burn calories, because the BMR, the rate of burning the calories is much lower. So in that setting, your cortisol will increase.
Mm.
And again, this is for people that are over 35, 40, okay? It's not for people that are 20, 25. But if somebody 20, 25 starts doing that, your testosterone is gonna go high, you're gonna be much more calmer, it's gonna work much better than exercise. And if you do it with exercise, it's gonna be even better, okay? Anybody, any other questions? Don't, just ask questions, don't worry about interrupting. Okay, this is what happens with high cortisol. You get hungry, okay? So if you get hungry, what's the point of, you lose weight, you put it back on. So it suppresses your immune system, it decreases serotonin, it does a lot of very good things as well. I just put all the bad things here. So the cortisol is important. You don't want to have cortisol below the normal range. Decreased sensitivity to pain, fatigue, sleep deprivation. Why do you think all the people wake up early and they cannot sleep too long? The cortisol is much higher as you are aging. So that's why they wake up early.
Other than what about stress part? This is also known as stress hormone, right?
Cortisol is a stress hormone, yes, exactly. And you need it because you need to get stressed if you need to run away from a danger, or you need to do something, it's necessary. And it has a lot of other functions that are very necessary for the body. But it also has, when it's over a certain threshold, then it's a problem. So it increases blood pressure, the whole thing, yeah? And here is glucose. Here is the problem with glucose. So you have hypoglycemia, okay, if you are below the threshold, right? And again, you have sweating and irritability and hunger and sleepiness and lack of coordination. And you can have hyperglycemia, and it's just about the same thing. You see, below and above, pretty much the same. Increased hunger, fruity breath, excessive thirst, blurry vision, nausea, vomiting, increased urination. And this is the results that we got, and these are diabetics. 72% normal after 12 treatments. 72% were normal, okay? The rest were pre-diabetics. So the status was improved, okay? And blood glucose postprandial was 60%, 66% normal after 12. This is major. It's like they were diabetics and now they're not diabetics anymore, okay? Not everybody, of course, okay? Some people are gonna need more treatment, so they have other complications. okay, but it does help them. And everybody, if it was not normal, it was pre-diabetes. So there was a significant improvement. This is, a lot of these studies were done in India, and you know what happens in India, you don't see these things in Hong Kong. People are really obese. This is a graph that I got from Mr. Lim. Basically, it's the cortisol also affects your metabolism. So when you have too much cortisol, then the T4 does not become T3, it becomes reverse T3, which is inactive. T3 is the only active aspect of this from TSA, from the thyroid stimulating hormone, that becomes T4. This guy is inactive, okay? And this guy is inactive. So you have this, it's gonna transfer it into T3, but if you have too much cortisol, then your metabolism is gonna be low.
How does the T3 metabolism work in the body? What does it do?
This is the metabolism. This is, without metabolism, you will die.
Well,
I
the
mean,
conversion, what about the conversion from white fat cell to the brown fat cell?
that's later on, yeah.
Is that part of that process?
Well, it is, because a metabolism is the main mechanism that gets the entire fat lipolysis in the body.
So let me ask you, because
Yeah.
I've seen the study, you see, I used to have keep a press here, there's a lot of fat.
Right,
So I've been doing this for a while, and right now I don't see a lot of fat.
yeah,
So I understand from what you told me earlier on, the white fat is not active, right? It's really, there's a lot of toxin in it.
right.
So, I find it more leaner right now. I think maybe there are more brown fat right now.
That's right, that's right.
So, is it because when I'm on this machine and all that, more T3 is being produced that converts the white fat to the brown fat?
That's right.
So, as a result, my metabolism is also better.
It's much better, yeah. You're getting the metabolism of a younger person.
Yeah. So, when you have a thyroid problem, the thyroid hormone problem, in general, you will feel quite tired because you're not processing the well. So this machine helps increase on T3, right?
That's right.
So as you have demonstrated in studies.
Yeah, yeah. Actually, we did a study here near there. Was I don't know, nobody from here.
Yeah, she does it. She has some information. So, but I think Sana, it's useful for ordinary person for me, to understand the process.
Yeah.
Because if I have to go on a machine and I know what's going on, my body gets worked out and all that.
That's right.
But right now I'm beginning to see the fruits of this. When I find that the fat is not there, at least I know
It's not there.
it's lessened. I know that the white fat is reduced. That toxic level is down. So information and it will help so much in information.
Yes.
But more important, I'm more energetic.
That's right. It's the energy. But what he's talking about, it's when I was discussing it before, I said the fat cells are very much like similar to that. A lot of things are similar to that in the body. So the white fat is like a T4, right? It just sits there. It just collects the energy. And it's only the beige fat is somewhere in between. Or the brown fat, it's the brown fat that basically creates the energy and the heat. And why? Because it's full of mitochondria. And this is the guys that create energy and heat. Whereas the white fat has no mitochondria in it. It's just, it sits there, okay? And it's full of fatty acids and triglycerides, and you definitely don't want that in your blood. I mean, so you don't want white fat in your blood. You want brown fat in the blood because it's gonna go and create more energy. But it's equivalent to this because it's only the brown fat that you can actually burn. The white fat is just an energy storage. It does other things. I mean, it has stem cells and other things. But
no, okay, one point over here is, Senna, as you're explaining this, in the past I used to hear you talk about the machine, the waveform and all that. But I think what's very important is the whole body of knowledge behind that. So as you know, it's not an easy feeling when I go through that 1 hour. But at least I know now that the white fat is being dealt with. So
That's right.
I have more and more brown fat, so my metabolism improves. So you don't get the rebound so easily. Your body functions better, right?
that's right.
But more important is because I understand that right now. So I'm in the sense I'm going to use this for a long time because I know what the kind. It's not only getting a fat, it's also bringing about the hormonal balances. So I'm able to convert right now my white fat to brown fat so that it doesn't sit there and become toxic. Then inflammation and that is something I have to deal with later on. So it's that link that is, I think, useful for one to understand, relate. If they can relate, then they know when they go through that process, which is not comfortable sometimes, but then the kind of benefit they get.
Yes, that's right.
So how do we impart that knowledge to people that can relate to, that can resonate with that?
Right, this is your job. I'm going to give you this PowerPoint and you're going to have to summarize it and try to explain it to others, okay? And I'm open to questions. You know, we can make a group and you can ask me a question. I will answer right away, unless I'm doing something else, you know. Yeah, you need to understand
I think that part is so important. I think, you know, sometimes I'm very, I look around and see people with big belly, you know, I think they're a problem. They have a problem. Because this thing is going to make them become more inflamed. So that is the source of a lot of sickness.
Oh yeah.
And it will, it's going to also have more of this bad cholesterol as a result of that. It's also going to cause them cancer and things.
Everything is going to be down.
Yeah.
Testosterone is down. Everything's going to be a mess.
So when you understand that
Cholesterol.
reducing the fat is more than just a appearance issue, it's very important health issue. If we get a piece right, and then this machine and it has its value.
Yeah, there is nothing in the market that can do what this technology does. Because the reason why is because we have invested all of our money in research. We don't care about, you know, having a big cars and big houses, and everything goes back to research, okay? And that is we're very research oriented. It started from Jerry. Jerry had no hobbies. His hobby was to go to the lab and work on this, basically.
One question over here. You mentioned the last slide. You mentioned the brain. What produces the hormone? But in this case, is it not the one on T4, T4? Just not the one. No.
Another one.
Where?
The last one.
No, you're going back.
Which one?
T3, T4.
Ah, the latest.
Yes.
Okay.
Okay.
This one.
Yeah.
This question, is it your hormone that's producing the? Is it your brain that's promoting hormone or your thyroid glands?
Oh no. It comes from the thyroid, but without this command, nothing happens.
Okay.
Okay, so your brain damage, your thyroid's not going to work. Okay, that's you know what I mean. It might work marginally, you know, because it does what it does, but it all works together as a whole. That's the whole point. That's one thing you learn in neurophysiology. When I started working with neurophysiology, I was like, oh yeah, this part is for this and this part is for that. It's not for that. And you know, professor, no, that's not how it works. The brain works as a whole. It doesn't one part like this and the other part like that. So everything works together. That's why if you have, for example, let me tell you one more thing, right? So you inject D3. So what can I just inject it. Do you see this thing? This is a feedback mechanism. It says, it goes there and it says stop. Because if I have too much D3, then it's going to disorganize you, okay? And I'll show you why right now. So you cannot, the injection cannot do it because they're going to give the same, more or less the same injection to all of us. And we're very, very different with very different needs. This is why, because if you are hyperthyroid, okay, you have all of these symptoms, which is fatigue, weight loss, something to call depression. Fatigue, depression, memory problems, hair loss, muscle pain. Hypothyroid is the same thing, fatigue, feeling, well, the only difference is one is fat, the other one is slim, but they're both ill, okay? So it has to be within the normal range. This is WNR means. So with everything that we have done, everything was at the peak, but within the normal range. And if people were, were healthy, you're gonna see a very small difference, because you don't wanna see any more than that, okay? You don't wanna see any major dramatic things, because then you're gonna be hypothyroid, okay? So everything has to be within the normal range. And of course, thyroid, every diabetic is hypothyroid, all of them. Because thyroid controls the insulin resistance, which controls the glucose, which results in diabetes. So it's all connected. You see, one thing goes wrong, everything goes wrong. It's the thing that I said in the beginning. And that's anti-aging, synchronizing and balancing and health. That's the real anti-aging. Everything else is just, waste of time, okay? And why is the visceral fat a problem? Well, you know that already. I don't have to tell you that. Obesity, metabolic syndrome, infection, injury, inflammation, asthma, cancers, joint pain, eye disorders, all kinds of things, Alzheimer's, the whole bit. So the body mass index, so you see, if somebody is here, if you find somebody who's 75 with this BMI, please let me know, because to date I haven't seen anybody. You know what that means? That's very scary. They die early, okay? They cannot live long, period. Okay, and this is what we found. We did find a very significant visceral fat reduction. Now this is 130 subjects, so it's like, some of them are ill, some of them are healthy kind of thing. So some of them had much higher reduction than others. And honestly, with diabetics, you do need more treatments, anti-diabetics, because the system is not working, metabolic syndrome. The BMI was also reduced by 14%. And this is what visceral fat is. Do you see this? This is a healthy body, and this is the visceral fat. It doesn't just wrap itself around your organs to suffocate them. It invades the organs. And you know what happens when it invades the organs? How are they gonna function? How is your liver gonna function if it has fat? They cannot, the liver cells cannot communicate with each other. Why? Because there's barriers in there. It's like you have outside there. You have those so you can concentrate, do your own thing. But in terms of communication, you need the visceral fat. And this is what visceral fat is. Do you see that? This is what it looks like. And this is what Mr. Lim was talking about. You see, the one that people say it only has like a couple of mitochondria, so it cannot produce energy. The mitochondria do the energy thing, right? This guy, the brown fat, you see it's packed with mitochondria. Then you have something in between that we call it the beige fat. So you have to translate this into this in order to basically create the energy, yeah? And this is what produces the energy. And this guy clots your arteries and you get blood clots from it. And then you either get brain damage or you die. Unfortunately, neither the fatty liver nor the visceral fat cannot be removed with surgery or liposuction or radiofrequency or lasers because all of those techniques are traumatic methods and they will traumatize the vital organs. So it's obviously not indicated. And they cannot do it anyway. I mean, the patient's gonna look very slim, but he's gonna be dead. Now, this is the high BMR and the low BMR. And look at this result, guys. This is an incredible result. It's almost 100% higher, your BMR. 91.6%. You're changing the way you burn calories, okay? Having said that, if you keep eating, and if you're hungry and you're eating, it's not gonna do very much. but it will reduce the hunger as we're gonna see further down, okay? And the skeletal muscle mass, 40%. Again, it depended on different studies, we had different results, yeah? Now, increasing BMR by 91% means that instead of burning 2,000 calories a day, you burn 3,819 calories, almost twice as much. Okay, that's major.
What causes that increase?
The basal metabolic rate means how many calories you burn.
Yeah.
Okay, if you increase how many calories you burn, sitting down or kind of talking, like how many calories I'm gonna burn now, right? If I normally burn 2,000 by normally, walking around, whatever, this way I'm gonna burn twice as many.
So the mechanism, could it be mechanism is T3 goes
It's
up?
metabolism again.
T3 go up and then your white fat gets converted to brown fat, increase the metabolism.
That's right, yes.
As a result, and then your.
That's right.
So it's not getting rid of fat per se, it's just the conversion process.
That's right, yeah.
So that's why your body is able to then.
That's why you got the
Optimal.
BMR higher. Yeah, exactly. Yeah, you have more brown fat, you burn more fat, you have your metabolism works faster, you burn more calories, obviously because of that. So your BMR goes up. So this is like the proof. This is your proof that this machine increases your metabolism and transfers white fat into, or translates white fat into brown fat to kind of create more energy. And this is your insulin growth factor. There are separate receptors in the body where the insulin growth factor, but insulin growth factor is for growth and differentiation, and you need that for stem cells, by the way, because without this guy, the stem cells are gonna sit there, they will proliferate, but they're gonna sit there and they'll create tumors, okay? And this is the negative part of stem cells. But if it's your own stem cells, like we do it with this machine, because the stem cells from the fat will be your own, these stem cells will always differentiate because your brain is in control. It's not somebody injected you from the outside that they don't know what they're doing, some other person, right? And the insulin receptor has to do with the metabolic functions, has to do with fat burning and metabolism, and the brown fat and the white fat that Mr. Lin was talking about. And this is another table. It's more kind of all hormones were within the normal range. At the very low density lipoprotein was reduced by 41%, triglycerides was reduced, HDL increased. You want HDL because that's what gets everything else and carries it out, yeah? Leptin decreased, ghrelin increased, bilirubin and creatinine. These variables, these enzymes are basically waste products or indicate there's a waste product, and they are associated with fatty liver, okay? And this is your inflammation guy, okay, very, very important. Now this one also indicates inflammation, okay? You have high bilirubin, high creatinine, you're also gonna have high inflammation.
How do you improve the ratio between the good cholesterol and the bad cholesterol?
How do you what?
How do you improve that? What's the mechanism like? With the T3 and insulin, and how this thing gets improved? From the bad cholesterol and then becoming less, and the good cholesterol becoming more.
Yeah.
What's the process like?
Well, it's a very complex process, right? That starts from you don't have as much toxicity in your body. Okay, one thing, right? Second thing, your stem cells, your own stem cells, will repair the liver, right? And the liver is going to be able to detox you better. Okay, so all of these things are waste products that have to come out, but they have to go through the liver and the kidneys. So your kidneys now work better. They're gonna create a much better exit for these variables, these enzymes, basically. And the inflammation is when you're inflamed, you're static Inflammation means being static. Okay, that's why you're tired when you have a lot of inflammation, because your body does not work properly. Okay, so you're going, but you're not going, kind of thing.
Then a question. The good cholesterol, when you have more of the good cholesterol, then you will reduce on the bad cholesterol, right? So
The good
you want to have
cholesterol.
more good cholesterol so that the bad cholesterol gets lessened, right?
Yeah.
So what's the process like? Is it because you clear on the bad cholesterol, you clear that out so that, or you create more good cholesterol so that it lessens on the bad cholesterol?
Yeah,
Which
well, the cholesterol is also energy. It
Yeah.
can be used for energy, right? But the problem is this. Here is a large triglyceride, right? And this is the VLDL. You see how very, very low density lipoprotein means it's bigger, right? It's like a balloon. Okay, so what happens is that here is the very low density. It stays in your arteries, cannot go through because it gets stuck.
it blocks your.
It blocks it. Well, if it blocks this, then your blood doesn't flow, all right? Your cells are not oxygenated. There is no nourishment to the cells. Antibodies are not properly distributed. The whole thing falls apart.
So you
Your
have
blood
problems
is,
like,
is everything.
strokes and also the vessels gets maybe blocked, right?
Yeah, well, that's what it does. You see, the virtual gym will increase this guy, which is the high density, because it's small. You see, this is, you see that's small, you see? It can go through. This is the low density, is bigger, yeah? And the very low density is even worse, and triglycerides is a mess. Okay? You definitely don't want these guys in your blood,
Yeah.
you know? Because they will damage you.
One question is, I understand what you were saying is the T3 and that helps convert some of white fat to brown fat, right? Is that conversion the same?
Yeah, this is fine.
Does it do the same thing from the bad cholesterol?
Yeah,
It leaves it and then it converts to the good cholesterol.
that's
Is
right.
that
Yeah,
the process?
yeah, exactly.
So
Exactly.
the T3 actually work on the white fat to the brown fat. At the same time, it works on the bad cholesterol to the good
Yeah,
cholesterol.
the body can do that.
So it's that process.
It's a process. Yeah, it's a process. Exactly. Yeah, the body can do that if the body has some way to kind of do that. So this one is going to go through your blood. This one is not. It's as simple as that. Okay. And unless you metabolize this and you make it smaller, kind of thing, right, to go through, the blood can do that as well, can push it through. This is why people have high blood pressure, because the heart is a pump. So if you have an artery like that, your heart is going to go through, right? Because you cannot go through, and your blood is all aggregated.
So just to confirm, as you have your T3 going up, yeah, then you convert the white to brown fat, right? So metabolism improves. But at the same time, what it does is also it reduce the bad cholesterol so that you have more good cholesterol.
That's
it's
right.
The same process.
That's right. It's the same process. The same process. It's the same process. It's up or down, basically. Yeah. Either you're going down or you're going up. You're gonna go up. Okay,
That's what we're seeing in the studies and all that. Because when you have T3 going up and all that, then you see the cholesterol level.
yeah, you see the cholesterol changing. Yeah, immediately. Yeah, that's why always when you do like a blood test, you always want to look at T3. If you want to look at cholesterol, you look at T3 to see, what's going on there, But if one is up, the other one is up. I mean, they don't. Okay, so this is leptin and ghrelin. I don't know if you've heard these hormones. They are your appetite hormones. One stops you from eating, the leptin. The ghrelin makes you hungry. You can have too much leptin, but has no signal. You're still gonna be hungry, okay? So it's the signaling. The whole point is not, this is what doctors from A4M and everywhere else, and incas, whatever. They don't understand. It's not what you put in the body. It's whether what you put in the body has a signal or not. If it doesn't have a signal, you're wasting your time and you're filling this person with something that is garbage. You're making it worse than it was before. So the important part is the signal, not how much you have.
Signal to bring about the balances? To bring about the balance?
Signal to bring the balance, but also the signal, the leptin has to have a signal.
Yeah.
It's the signal of the leptin that makes you not be hungry. It's not the leptin per se, okay? If it's like an employee that comes to work but doesn't work, doesn't move his arms, doesn't move his legs. What are you going to do with this employee? He's useless, right? You could just hire like 20 of these employees. You just have an office that's totally dysfunctional, okay? So again, we found an increase in leptin and a decrease in ghrelin. And again, you don't want to have over the normal range. So you say, oh, it's only 12%. No, it's not like that. It has to do with where it was before and how much space you have to move, because it has to be within the normal range. Oh, what am I going to say? I'm going back. Okay. And this is the toxicity. If you're toxic, you're hungry. If you're hungry all the time, no matter how young you are, you're toxic. You need to do the virtual gym. Period. Okay? And detox drinks, they're not going to work in the long run. You need this. Okay? Or you need to go to a gym and stay there for 5-6 hours a day. Okay, so basically, because toxicity interferes with everything, not just leptin and ghrelin, interferes with your metabolism, interferes with your BMR, it interferes with your sex hormones, with your gut hormones. You have the indigestion, okay? That's because you're toxic. When you have indigestion, it's because you are toxic, okay? So the more toxic you are, the more hungry you are, okay? So hormonal imbalance leads to hunger, leads to eating, leads to weight gain, leads to toxicity, and back to hormonal imbalance. So you are stuck in a vicious circle. And leptin does a lot of other things, you see. Everything does other things at the same. So if this is messed up, look at everything else that is going to be a mess. Kidney, pancreas, muscle, bone, vascular system, reproduction, hormonal regulation, all that is going to go a mess. Same thing with ghrelin. You don't want to have no ghrelin at all. Well, I might as well have no ghrelin. That means I don't have to eat. No, it doesn't work like that. Everything is important. Ghrelin is important because gastric motility affects on reproductive, affects on glucose and lipid metabolism. That's what ghrelin does. Anti-inflammatory effects, modulation of cell proliferation. All of these things are important. So you can't say, oh, I don't want this. I might as well, get rid of it completely. This is what the doctors do, and it's wrong. We have a device that we can do it through our own brains and reinstall anti-aging in our bodies, okay? Like you put hardware, and software in your computer, okay? It reinstalls balance in our bodies. It wakes up the body's intelligence, and your body acts and feels younger. This is 8 ways that inflammation can damage your body: memory loss, cognitive decline, increased cardiovascular ring, abnormal growth of healthy cells. That means cancer, by the way. That means tumors and cancer, okay? Just to say it with its real name. Compromised digestive function, loss of muscle tone, weight gain, accelerated skin aging, blah, 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 okay? So we did find, and all of these are inflammatory, so we found 69% of bilirubin went down, 19% of creatinine, and CRP by 36%. Again, nice percentages don't mean much because it depends. You need to be within the normal range, and that's the important thing, okay? this is the symptoms of high creatinine, and they're pretty much the same for bilirubin and creatinine. You know, muscle cramp, fatigue, itching in the body, swelling in the body, gastrointestinal diseases, allergies, diabetes, so on and so forth.
So,
And then,
so the question is, this bilirubin
yeah,
is a waste, right?
it's a waste product, yeah.
It's a waste product. So the lesser, that means your body is, you don't have a lot of waste, is that?
Yeah.
Or is it because your liver functions
Right.
better?
Yeah, that's the excess. But creatinine is also useful. And everything is useful in the body. It's what the Greeks said, pan metron ariston. That means everything in moderation is extremely useful. Once you go higher or lower, it's a mess. You don't want that.
So again, the question is, this bilirubin is the indication of whether your
Liver.
liver functions.
Yeah, liver doesn't function. Well, bilirubin is everywhere. It's in other organs. Like nothing functions basically. Your kidneys don't function. A lot of things don't function.
Okay.
And this is another thing that we looked. Okay. This is the ultrasonography reports that we looked. Yeah. This is the fatty liver. These guys paid for their own sonography reports, and they gave us the results. And 80% of them, they had fatty liver, no fatty liver afterwards. And 20% they had significantly improved, but they were more sick, they were more ill, okay? What is the predictors of non-alcoholic fatty liver? It's alanine aminotransferase, aspartate aminotransferase, alkaline phosphatase, elevated creatinine, bilirubin, triglycerides, CRP, insulin resistant, low albumin, high glucose, obesity, metabolic syndrome, okay? And you can see that we can get on all of those. So we did a study, this is a new study, only 10 subjects, and we looked at the ALT, the alanine aminotransferase, and the AST, ALP, albumin. I'll say it by the short names because it's such long names. And we did find a significant difference towards the optimal direction. That is your proof. That is your proof. That is repair, not just visceral fat. We did not just get rid of visceral fat. Repair. There is repair in the liver. That is very, very important statement, okay? And this is what, again, you get the stomach pain, fatigue, swollen belly, the same, we spoke about that before. So you get improved fatty liver, improved all of those, okay? What this means is that the fat cells, your fat cells from your fat, stem cells, from your fat cells, your stem cells, were released into the bloodstream. They differentiated into mesenchymal stem cells, which differentiated into hepatocytes. And you need hepatocytes to make albumin. That's why you have higher albumin, because you increase hepatocytes in the liver. So, of course, you did not take to look into with them. You cannot anyway. Even if you want, you wouldn't be able to do that in a live person. Even dead people, you probably cannot do it. But what you see is that you see all of these variables. These are the variables that people are measuring when they put the injections with the mesenchymal stem cells. So we can do that without the injection. Repair the liver. It doesn't just repair the liver, it repairs everything, okay? It repairs the kidneys, all the vital organs, okay? So it balances your hormones, it decreases your cholesterol, and increases your immunity, okay? This is an interesting part here. Remember COVID-19? You all remember it still, right? Well, this guy, this is what we call, this is the cell, and this is the receptor of the cell. This guy goes and trims it, so this guy fits in there. And then it releases its contents. It releases this little thing into your blood cell, and that's when you're infected, okay? Here it comes. The fat has a lot of this. The fat has a lot of these receptors, the AC2 receptors. So it's like a field of flowers, and here you have the bees and the go and all the flowers, right? The fat does not have that many. So when you're changing the fat and you're turning into muscle, you are protecting the spread of the disease, because these cells are protecting everything else. You see, they cannot get infected as easily because they don't have as many AC2 receptors. There is another very interesting thing. Why is it that some people die and some people survive? Okay, the people that die, COVID-19 has affected their innate immune system. You know that from the interference response. You have two aspects of the immune system. You have the innate, that means as soon as the virus comes in, it says, no, we don't want you, we want to blah, 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 right? And then you have the adaptive that says, I know who you are. You're an HIV virus, you're a COVID virus, you're COVID-19, you're a SARS, whatever. The adaptive recognizes the virus and fights it. Here comes the problem. If you don't have the right interference in the innate immune system, you will never be able to activate the adaptive immune system. Because the innate tells the immune system, the adaptive immune system, here comes something. There is an enemy coming. If you don't tell the adaptive immune system there is an enemy coming, the adaptive immune system is going to go about its way walking in the park. Okay? So the people that naturally have more interference survive. But it blinds you, and that's why this disease has been so tricky and so nasty. And this is what the new technology does. So before it was like you lift your arm like that. Now because we see this height open slowly, slowly, slowly. So it's like I'm lifting my arms very, very slowly. When I lift my arms more slowly, you can experience, you see the muscle there. So you can see that, and the movement is like, you have to feel it. It's very. Oh, this is very important. Okay, why don't we need cardiovascular? Okay, because we don't know why, but we did this study and we saw. Actually, we had a microscope and we're carrying it with this in different expositions and things. We had like about 1,200 samples from different people, right? Everybody's blood was an improvement. So the blood cells, this blood is not doing much, okay? You need the blood to be, this is the blood of somebody that dies at 60, and this is the blood of somebody that dies at 100. Okay, that's the big difference, okay? And what we saw is for some reason that we don't know why, we saw a separation after doing this technology. You can get a microscope and do it yourself, so you're gonna see a separation. And there was about 16 out of 19 subjects had complete separation, and about 3 subjects had some rouleau and some separation, okay? Mostly separation. And this is what it does. Oxygens the cells, nutrients, antibodies, enhances immunity. So you wanna carry a heart from here to the hospital, right? So this is a lab. And you go out to Hong Kong in heavy, heavy traffic. What's gonna happen? The patient will die, right? This is the blood that is aggregated, heavy traffic. Now you wanna carry the same heart in the middle of the night, boom, right to the hospital, the patient survives. This is the red blood cell separation.
I want to know what is the hypothesis for this finding in your study?
The hypothesis in different studies, you mean?
For separating the
Oh,
cell,
okay. What happened is that, this is a long story, but anyway, somebody was trying to sell us a microscope.
I know that.
And they brought it in there, and I said, okay, well, let's try it. And we tried the microscope, and then we observed that as soon as somebody had done the treatment, his blood cells were like very active. They were moving very actively. And we said, this is interesting. Why is this happening? We don't know why it happens. So there was no hypothesis. It was by chance we found out. And then we started getting a microscope and looking at everybody. Every single person, as soon as you do the treatment, the blood cells would be separate. It was like crazy. We don't know why it probably has something to do with because the machine does not work with electricity. It works with voltage. So the voltage creates a you know what I mean, a spur. So that's probably why. But we had no hypothesis. This was like an empirical finding. So the true science comes through empirical research. This is a trial and error research, like the Edison discovered the light bulb by trial and error. Jerry did the same thing. He had no hypothesis. He was just trying different things. He was playing around with it, okay? So no hypothesis. That's the best research. If you have a hypothesis, you have already biased your data with your hypothesis, okay? Okay, so this is the history. Basically, Jerry was hired by the Multiple Sclerosis Society to do a sort of a pacemaker for multiple sclerosis. Okay, so of course that is central nervous system, is not the autonomic nervous system, because the pacemaker basically replaces the function of pacemaker cells. So he said, well, you know, let's replace the function of motor nerves. This was far, far more difficult. So he was supposed to do it in a year. It took him 27 years to do it. Obviously much, much longer than expected. And then I came along in 2002, and of course, because I'm more neurologically inclined, and I said, so, well, you know, this must go to the brain. You know, this is not, you're not addressing motor nerves yet, because motor nerves by themselves are not going to do what you're doing. You must be involved in the rest. So that's when we started looking at hormones, and that's when we started improving and fixing the formula and tweaking it here and there to make it far more synchronized with your central nervous system. And this is some very early research in the 90s, before the first device. The first device came out in 1994. It was the irises. And they looked at the RNA, and they found an increase in the RNA content of the slow type genes. And said, well, you know, this is like muscle, the muscles will increase. Oops, sorry. And this is my books, and it's been translated in 6 languages. That's the book I did on COVID, but the book on COVID has all the research on the virtual gym. Because I'm talking about COVID, and then I'm saying, you know, this is kind of a solution that can be used other than exercise. And this is just some more scientific articles. Okay, this is an important slide. This guy, Romanov, we have sold a lot of machines to NFL. They bought it for personal usage to increase the stamina and the speed. This guy had an injury on his foot. His foot was like this. He could not move, okay? He had metal all over the foot. There was only one surgeon in the United States who operated on him. And we started doing the technology. For the first time, he was able to bend his foot. And we were able, because we did everything for free, and we were able to get a testimony. We cannot get a testimony from anybody else that sold, you know, they sell the names anyway. And this is Timo as well, that he allowed us to give testimony. Just some before and afters. That's actually that's 2 treatments, not 1 treatment. Because that's 6 treatments. I did not do that. That's 15 treatments. That's that's a very older version of the technology in India. That's 1 treatment. That's from Indonesia. This one we did it together. This is here in Hong Kong. 1 treatment. Just 1 treatment. That's from Elaine. Detox. Actually, you cannot see it, but her leg was like much, much smaller. Now you remember that, right? Okay, this is the problem with lasers, okay? There are some laser studies that they say, oh, we can do visceral fat. So what they do is they have a low-level laser and they have exercise and they combine it. Of course, we don't know if it's the laser or the exercise. The problem comes when they try to replicate this study, that they cannot replicate it. So they replicate and they don't find the same results. So it depends, it's a sample selection issue. What means you collected all the people that are gonna have a good results. And now you collect some other people and you cannot get the results anymore. So this is lasers, they cannot do visceral fat. If they start telling you they do visceral fat, just don't believe them. So basically, the lasers and RF, they don't increase metabolism, they don't detoxify. They say, okay, the body will do it. Okay, if it's a young body, will do it. But it's a body that doesn't have the right liver, it's not gonna be able to do it. And results will rebound. Here, the results will not rebound. Why? Because now you're fit. You're fit and healthy. So your results will not rebound. And the other problem is that you indiscriminately release all the fat contents into the bloodstream, including the white fat. Okay, remember white fat, the triglycerides, and what's going to do to your arteries? So it can block your arteries. Now, if you're a younger person, yeah, you can handle it. But if you're an older person and your blood is more aggregated, that's not going to happen. Okay, so. And without exit, if you do a laser, you gotta do a virtual gym right away. At least you can utilize some of this glucose in the blood. You know, otherwise, with repeated usage, it could be a danger of diabetes or other problems. So triglycerides and toxin can remain in the blood and can clog your arteries. That's the big problem. And this is the muscle stimulator. You know, don't ever say that this machine stimulates the muscle, because it does not. Okay, what a muscle stimulator does, it sends up to 20 to 30 electrical pulses per second to the muscles and targets individual muscles. That's why they put black and red together. So you go like that and you're supposed to do something. With repeated usage, because they use energies, electricity over 60 milliamp, they burn the muscle with repeated uses. Why? Because anything over 1.5 milliamp will deplete ATP in the system. ATP is the energy in the system. Because it gets the calcium, depletes the ATP, the muscle cells will die. Okay, so in the long run, they will age you. Okay, this is not anti-aging. This is anti-aging and this is not anti-aging. This is a huge difference. Okay? And I think that's it. And that's some of the people that have done some research for us. And that's it.
Okay, let me ask you a question.